Welcome to the Pharmacy Frontiers podcast, a podcast dedicated to the profession of pharmacy. Today, we're excited to turn over the podcast to the students from the St. Louis College of Pharmacy at the University of Health Science and Pharmacy in St. Louis with their podcast titled Dose of Knowledge. We give credit to Professor Stephanie Lucas and Terry Walholick for mentoring these students for these leadership podcasts. Let me remind everyone that the Pharmacy Frontiers podcast is available for streaming on your favorite podcast streaming app, whether it be Apple, Podbean, Spotify, or YouTube. The comments and opinions shared today are those of the hosts and our guests and are not official statements of the Missouri Pharmacy Association, Mitchell Pharmacy, Mercy, nor the University of Health Sciences and Pharmacy in St. Louis. Now let's hand the microphone over to our students.
Picture this. You walk into the pharmacy, hand over your prescription, and a few minutes later, like magic, you've got that little white bag with your name on it. But have you ever wondered how the pharmacist knows what's safe for you?
Yeah, like where does all that knowledge even come from? It's not just sitting in the back memorizing drug names. It's years of schooling and constant training.
Today, we're pulling back the curtain on the hidden world of pharmacists, what it takes to get here, and how pharmacists keep up with it all. My name's Ashton.
This is Rhea.
This is Gadir.
I'm Duha.
And I'm Nora.
And we are second-year pharmacy students at the St. Louis College of Pharmacy in St. Louis, Missouri. Joining us are lovely Dr. Grice.
Hi everyone, I'm Dr. Gloria Grice. I'm the Associate Dean for Academic Affairs at St. Louis College of Pharmacy. Thank you for having me.
Welcome to the podcast where we will be discussing the topic of how does a pharmacist know how to do that. We'll start off by going over background education, Doctor of Pharmacy program, and life after pharmacy school. Can you believe that pharmacists are doctors?
Yeah, a lot of people actually don't know that. All right, let's kick things off at the very beginning. Before even applying to pharmacy school, future pharmacists have to complete required courses, also known as prerequisites, like chemistry, anatomy, physiology, and even calculus. It usually takes 2 to 4 years. Think of it like building the foundation of a house. You need a solid base before you can build the walls. For pharmacists, that base are those undergraduate years.
Then comes the big one, pharmacy school itself, the Doctor of Pharmacy program, or PharmD. That's 4 years where students become true medication experts. Sure, 4 years sounds like a long time, but it's a training camp by the end. You earned that degree.
So the next time someone says pharmacists are just pill counters, remember they've spent nearly a decade preparing for this. And speaking of pharmacy school, Rhea, why don't you tell us what actually happens once you're there?
Thank you, Nora. What actually really happens during those 4 years? Spoiler alert, it's not just endless drug names, though trust me, there's plenty of that too.
Oh yeah, definitely. For the first 3 years, we're learning in the classroom, and then the 4th year, we're finally out there working with real patients in the real world.
Yeah, those first 3 years are where you learn how medications work and the body work hand in hand. There are classes that prep you for every part of a pharmacist's job.
According to the ACPE, that's the Accreditation Council for Pharmacy Education, students are required to take a mix of courses across several years.
Right, so starting with biomedical sciences, that includes anatomy, physiology, and immunology.
Then we move on to pharmaceutics, which is the study of how your medication is made and why it's made that way.
And don't forget the social and behavioral sciences too. Things like ethics and the history of pharmacy. That's where we learn the human side of the profession.
Exactly. And then there's clinical sciences, like patient safety and pharmacotherapy, where we're taught something called the PPCP, which stands for Pharmacist Patient Care Process.
PPCP basically teaches us how to care for patients. It walks you through collecting information, assessing it, identifying medication-related problems and needs, and then planning treatment with patients and their healthcare team.
And it doesn't stop there. You also implement what you planned, educate patients, and then follow up to make sure it's working. It's a full, continuous care process.
All of these classes are required to make sure we succeed, not just in school, but when we take the National Pharmacy exam at the end of those 4 years.
And here's something pretty cool. Our pharmacy school uses what's called the Integrated Pharmacotherapy Program.
Yeah, that's a mouthful, but it's actually pretty special because only a handful of pharmacy programs across the country use it.
Dr. Grice, since you're here, can you please tell us what integrated pharmacotherapy really means?
And we'd love to hear your thoughts on how integrated pharmacotherapy compares to programs that don't use it. What kind of difference does that make for students?
Yeah, I'd love to talk about it. So, integrated pharmacotherapy or integrated curriculum is essentially an approach to education where a body system is what is used as the organizing principle to teach related science and clinical skills. So, in our program, our integrated pharmacotherapy series includes pathophysiology, pharmacology, medicinal chemistry, and then therapeutics, both prescription and over the counter. So we do that in a combined way for every body system, such as pulmonology, cardiology, nephrology, infectious disease, etc., just to name a few. And why this is most useful as a pedagogical approach is because it allows students to relate both the pharmacy and science background of drug classes while they're also learning how they are used for disease management. So it's a holistic and efficient way to package all of the relevant information about one particular disease at a time. And that allows for the most deepest connection between those subjects and better learning.
Great, thank you.
Thank you.
Thank you. And let's not forget the labs. That's where students learn how to consult patients on medication, like reminding them not to drink grapefruit juice while taking a certain drug, in addition to learning and how to take the medication.
Exactly. Now, a quick pro tip. If you want to win over a pharmacist, don't bring grapefruit juice into this.
And of course, there is math. Pharmacy math is high stakes. The right dose for a newborn looks nothing like the right dose for an adult.
Now, beyond the classroom, there are also rotations. First, the shorter IPPEs, which stand for Introductory Pharmacy Practice Experiences, where students rotate through the community and hospital pharmacies. Then the big capstone APPEs, which stand for Advanced Pharmacy Practice Experiences. Those last the entire final year and cover hospitals, general medicine, community, and specialties. Students learn directly from the preceptors, which are licensed pharmacists and that are actually caring for real patients.
So, Dr. Grice, how do you know if pharmacists that are graduating are ready for real life?
Is anyone really ready for real life? Well, we feel pretty confident when our students graduate that they are ready to practice. And we feel confident because we have developed an outcomes-based curriculum. And what that means is we define a set of outcomes that we want every student to achieve by the end of their 4 years with us. And as long as they're satisfying their progression requirements, they are achieving those graduation outcomes. So they demonstrate to us they're ready by moving through the curriculum, passing all the necessary courses, as well as milestone progression exams. The real test, however, comes with licensure examination. So once they graduate our program, it just says that they're ready to take the licensure exams. But they do have to pass 2 big licensure exams to be ready for real life. And that is the NAPLEX, the North American Pharmacy Licensure Exam, and the MPJE, which is the Multi-State Pharmacy Jurisprudence Exam. And so that is based on a particular state that they're wishing to work in. So they do have to pass those, and someone else decides at that point that they are officially ready.
Can't wait for that one. Now, school is tough, but for many, it's just the beginning. Ashton, why don't you walk us through what comes after graduation?
Yeah, sure. So for a lot of pharmacists, the learning doesn't end at graduation. Some pharmacists pursue residencies, kind of like medical residencies. The first year, called Postgraduate Year 1, or PGY1, builds a strong all-around foundation.
And if you want to specialize, that's where the second year of residency, or PJY2, comes in. You might focus on oncology, meaning cancer patient, pediatrics, which is children, or even practice in emergency medicine, which is working with patients in the emergency department.
Exactly, that's mainly for clinical residencies, but not all residencies have to be in the hospital. Some pharmacists do a managed care residency, which can look like working with insurance companies to make sure patients get the right medications.
Yes, and others go into academia after completing residency or PhD program, which means teaching pharmacy students are doing research or ambulatory care, which is more like working in a clinical setting to help patients manage condition like diabetes.
Right, and then there are fellowships, which are commonly found in pharmaceutical companies. Pharmacists in fellowships might work on new drug development, clinical trials, or finding safer ways to use existing medications. These usually last 1 to 2 years.
Right, and fellowships aren't all just in industry. Some fellowships focus on academia, where pharmacists study big questions in medicine and teach students. Other fellowships are in the government or public health, where they help to develop medication policies and make sure drugs are safe for everyone.
Yeah, and there are specialties for fellowships too, like pharmacogenomics, which is studying how your genes affect how medicines work in the body. So whether it's patient care or research, pharmacists keep training long after school. If you want to know more about residencies and fellowships and other opportunities for residencies and fellowships, you can learn more about it at the American Society of Health System Pharmacists, the ASHP website, the American College of Clinical Pharmacy, the ACCP website, or the Industry Pharmacist Organization, IPHO website. They're all great resources to look more into that.
So, Dr. Grice, you went through pharmacy school and residency. Can you tell us a little about how this made you into a successful pharmacist and what your journey looked like?
I can. How much time do you have? I did go to pharmacy school. It was a very, very long time ago. So we had a lot less drugs than what you guys have now. I actually didn't want to be a pharmacist. I wanted to be a physician. And my mom convinced me that pharmacy would be a better career to have a family. So I kind of listened to her and never regretted it. I just didn't have a passion for community pharmacy, and that's really all I thought pharmacy meant. But I ended up applying to work at the National Institute of Health in Maryland, where I'm from, and they put me in the pharmacy. And I, again, really didn't care for a lot of the tasks, but there was a gentleman there, his name was Frank Pacino, and he noticed I was bored, and so he said, "Come on up with me, I'm going around." And at the National Institute of Health, most of the patients that are admitted there are in some kind of study. So you might not even know what they're taking because it's placebo or it's study drug. And so it complicates a lot of their symptomology and their differential diagnosis. And it was the most fascinating thing I had ever seen was Frank Pacino on rounds at the NIH, because the entire team would say, "Frank, what's going on? Frank, what's the symptom? Frank, what labs do we order? Frank, how do we adjust meds?" And I had no idea that pharmacists had so much ability to influence how patients were being cared for and managed. And I was sold. I was like, yep, I definitely want to do this. So I did my prerequisites. I did 2 years of undergrad work at the University of Maryland, and then I got into the University of Maryland's pharmacy school. And I'll tell you, my journey of not really knowing what I wanted to do continued there, because every year of pharmacy school, I completely changed my mind on what I wanted to do. I went from being a person who wanted to be in industry to someone who wanted to subspecialize in psych, to then deciding I had no idea what I wanted to do, and I turned to my advisor and I'm like, I don't know, I like so many things. And they said, yeah, you should try family medicine. And so at the time I actually was able to do a PGY2 without having to do a PGY1. Yes, I'm that old. And so I applied for family medicine residencies, and that's what brought me to St. Louis a very long time ago, and I absolutely loved it. It was exactly what I wanted. It was the breadth of all sorts of conditions, different ages of patients. I ended up staying in family medicine for 6 years, and then I would have probably stayed there had an opportunity not come up for me to do pharmacogenomics, actually. I heard you mention that. Yeah, it's a really cool field of medicine, and I specialized in clinical research for another 6 years of my life. And then another opportunity opened up to be the director of experiential education here. And so I did that, and then kind of took a few different administrative roles. But if you're paying attention, I take opportunities that come up to me, and that's kind of what I would say is like led to my success. Is I've not really fixed myself into any one box. I've been very curious. I've said yes to open doors, and I was willing to take risks and completely change my career. But I think that's what expanded my skill set and my knowledge, and it actually opened up more doors having had all those experiences. So I think that's the success, and I will tell you, my journey's not over. So I am still on the journey, still looking for the next open door and things that I can do to try different parts of my career and expand even more.
Wow, I love that
So
story. Yeah,
inspiring.
thank you.
And speaking of learning that never stops, Dua, can you tell us how pharmacists keep up once they're out in the practice?
Thanks, Ashton. You know, a lot of people think when you graduate, you're done learning. In pharmacy, that couldn't be further from the truth. Medicine is constantly changing, new drugs, new guidelines, even sudden safety alerts.
Yeah, it's like the rules of the game shifting. So you've always got to be on your toes.
That's why pharmacists complete continuing education, basically ongoing training, to stay up to date. Think of it like a software updates. You wouldn't want your phone running on an old version, right? Same with a pharmacist. We can't rely on outdated info.
And there are so many resources like the American Society of Health System Pharmacists or the ASHP or the CPE, a monitor also known as the Continuing Pharmacy Education, where pharmacists keep track of their required yearly course hours, also known as continued education, which are like 15 hours per year or 30 hours per 2 years or every 2 years. The Centers for Disease Control and Prevention, or the CDC, plus organizations that connect pharmacists with advanced training and fellowship. It all comes back to one thing: keeping patients safe.
One way that pharmacists stay up to date on medication guidelines is through different websites. One of them is called Up to Date, and another is called LexiDrug, where it keeps the pharmacists updated with current medications because guidelines are always changing.
So let's bring this full circle. Becoming a pharmacist takes years of science courses, 4 years of pharmacy school, countless hours of rotations, and often residencies or fellowships.
And even then, the learning doesn't stop. Pharmacists are constantly updating their knowledge to make sure patients get the safest, most effective care.
They're also some of the most accessible healthcare professionals you'll meet. Whether it's side effects, drug interactions, or lifestyle advice, your pharmacist is right there for you.
So next time you're at the pharmacy counter, remember you're talking to someone with nearly a decade of training and a lifetime of learning.
And if you're a student listening, maybe today's conversation gave you a clear roadmap into pharmacy.
Okay, so thank you, Dr. Grass, for tuning in to How Does a Pharmacist Know How to Do That. Until next time, stay curious, stay informed, and remember your pharmacist is a doctor and they went to school for over a decade. So next time you have a question,
Ask the medication expert.
A big thank you, students, for hosting the Dose of Knowledge podcast as part of the Pharmacy Frontiers. And thank you to our listeners for joining us today. Please share this episode with your friends and seek out other Dose of Knowledge podcasts on the Pharmacy Frontiers podcast page that can be found on your favorite podcast channel.